Today we are going to learn about the drug profile of metformin. Summary: Metformin is a bigunite antihyperglycemic used in conjunction with diet and exercise for glycemic control in type 2 diabetes. It also used for insulin resistance in polycystic ovary syndrome. Metformin is the first-line pharmacotherapy used in the management of type 2 diabetes. It is considered as anti-glycemic drug because it lowers blood glucose concentration. It is commonly described as insulin sensitizer, leading to decrease in insulin resistance and reduction of plasma fasting insulin values. Another well-known benefit of this drug is modest weight loss, making it an effective choice for obese patients. Metformin was first approved in Canada in 1972 and received subsequent approval in USA by 1995. Properties: Molecular formula is C4H11N5. Synonyms are dimethylbiguanide, metformin HCl, metformin, melvin, etc. Weighs approximately 129. Brand names are Ecnoplasmed, Fortamed, Glycophase, Glycon. Generic name metformin. Melting point about 223 to 226 degrees Celsius. Boiling point about 224 degrees Celsius at 760 mm of Hg. Its primary work is to decrease the amount of glucose your body absorbs from things you eat and drink. It reduces the amount of glucose that your liver makes. Metformin also helps your body's own insulin to work better. Mechanism of action: Metformin acts on intestine, which results in increased anaerobic glucose metabolism. It also acts on liver, which results in decreased gluconeogenesis, glycogenolysis, and fatty acid oxidation. It acts on skeletal muscles, which results in increased insulin-mediated glucose uptake, glycogenesis, and decreased fatty acid oxidation. All these results leads to decreased hyperglycemia. Oral dosaging for adults. For immediate release, initial dose is 500 mg orally twice a day or 850 mg orally once a day. Dose titration: increase in 500 mg weekly or 850 mg every 2 weeks as tolerated. Maintenance dose is 2000 mg per day in divided doses. Maximum dose is 2550 mg per day. For extended release, initial dose is 500 to 1000 mg orally once a day. Dose titration increases in 500 mg weekly as tolerated. Maximum dose is 2000 mg per day. Oral dosaging for pediatrics. For immediate release, initial dose is 500 mg orally twice a day. Dose titration: increase in 500 mg weekly as tolerated. Note: daily dose should be taken in divided doses 2 to 3 times a day with meals. Maximum dose is 2000 mg per day. For extended release, initial dose is 500 mg orally once a day with evening meals. Dose titration: increase in 500 mg weekly based on glycemic control and tolerability. Maximum dose is 2000 mg per day. Oral dosaging in the form of solutions. For adults, at first 5 ml 2 times a day or 8.5 ml once a day with meals. Your doctor may increase your dose if needed until your blood sugar is controlled. However, the dose is usually not more than 25.5 ml per day. For children 10 to 16 years of age, at first 5 ml 2 times a day with meals. However, the dose is usually not more than 20 ml per day. Precautions. Metformin, if not contraindicated, should be considered first-line therapy for management of type 2 diabetes. For immediate release, taking divided doses 2 to 3 times a day with meals. Titrate slowly to minimize gastrointestinal side effects. In general, significant responses are not observed with doses less than 1500 mg per day, and doses above 2000 mg are generally associated with little additional efficacy and poor tolerability. For extended release, take with the evening meal. If glycemic control is not achieved with 2000 mg once a day, may consider splitting daily dose to 1000 mg twice a day. If glycemic control is still not achieved, consider switch to immediate releasing product. Pharmacokinetics. Absorption. Metformin is rapidly and almost completely absorbed from the gastrointestinal tract after oral administration. The absorption primarily occurs in the upper part of the small intestine. The absolute bioavailability of metformin is approximately 50 to 60%. Distribution. Metformin has a relatively low volume of distribution, indicating that it is largely confined to the plasma. It does not extensively bind to plasma proteins. Metabolism. Metformin is not metabolized by the liver. It undergoes minimal metabolism and is excreted unchanged in the urine. This characteristic makes it a renally clear drug. Elimination. The elimination half-life of metformin is approximately 6.2 hours in healthy individuals. However, in patients with impaired kidney function, the half-life may be prolonged due to reduced clearance. The drug is primarily eliminated by the kidneys, with approximately 90% of the administered dose excreted unchanged in the urine. Interactions. There are many drug-drug and other interactions with metformin. You should be aware of those before administering metformin. Here are some of the interactions with metformin. Warnings. You should not use metformin if you are allergic to it, or you are pregnant, or having several kidney diseases, heart diseases, and liver diseases. And also, if you need to have any type of X-ray or CT scan using a dye that is injected into your vein, you may need to temporarily stop taking metformin because you may develop lactic acidosis, a dangerous buildup of lactic acid in your blood. So, follow your doctor's instructions about using metformin. These are the side effects of using metformin. Some are more common and some are less common. If you have any of these symptoms while using metformin, immediately consult your doctor. Take metformin with a meal. Do not crush, chew, or break an tablet. Measure liquid medicine carefully. Shake the oral suspension before usage. To quickly treat hypoglycemia, eat or drink fast-acting source of sugars. Regular checkups. Follow your doctor's instructions carefully. Here are the 7 steps for better living with diabetes. Once check on it. For further reference, follow these links. Hope you all understood about metformin. Thank you.